I remember looking at my daughters and thinking, will this be my last Christmas? I was watching them open presents from my recliner, where I spent most of my time. Multiple myeloma had attacked my spine, broken 5 vertebrae, and made it excruciating to walk. I could see the concern in everyone's eyes when they looked over at me. But having grown up on a farm in a family that didn't really talk about how they were feeling, their concern was too much for me. The weekly treatments had been hard, but mentally I was just coasting along, only focused on getting through another week. Everything changed a few months later when I was about to be admitted for high-dose chemo and an auto stem cell transplant. As we discussed the protocol, my doctor asked me, "So, what do you want us to do if your heart stops?" The question felt like a slap upside the head, and I realized then that this was really serious and was going to be incredibly hard. The transplant team was amazing, and they checked in often. But whenever they asked me, "How are you doing?" I replied, "I'm fine." "Any changes?" "No, I'm doing okay," even when I wasn't. Old habits are hard to change. I started to notice that the nurses would come in when Linda, my wife, was visiting, and would always turn and ask her what she thought when I gave them my typical 2-word answers. She was a registered nurse and would always give me the side eye before saying, "Well, actually," and fill in the symptoms that I was having. Those check-ins always ended with something that helped me feel better. I would get a sleeping pill or a nausea or pain medication. And as my symptoms got better, I slowly began to realize that I needed a goal to get me through everything. I decided that my goal was to go back to work. 36 days after my transplant, I walked through the doors of the firm, feeling like I had hit a home run in the bottom of the ninth. I'd done it. And it was like the dugout emptied and everybody came to congratulate me. Getting back to work was a good goal for me as I went through my treatments and recovery, but as time went on, I realized that maybe my goals had changed. I had changed. I was ready to retire and move on to other things in life. I wouldn't have made it through cancer without Linda, but not everyone has a Linda to help them explain to their healthcare team what matters. Continually asking cancer patients and their caregivers what matters to them is important because things change.